Well, joining us now is In Focus Health correspondent Lindord Moudou with a report on Africa's children.
Right, it was a day to think about the children in Africa. June 16 was the Day of the African Child. Initiated in 1991, the day brings into focus issues that affect the development of children and their well-being. This week, the African Union and other groups gathered in Washington to commemorate the day. The lives of millions of children are at risk in sub-Saharan Africa. The humanitarian groups UNICEF and Save the Children say that from 1990 to 2007, the number of children under 5 who die each year has increased from 4.1 million to 4.5 million in 2007. And today, about half of the world's under 5 deaths occur in sub-Saharan Africa. On the Day of the African Child, about 100 African diplomats, American politicians, and members of humanitarian groups gathered on Capitol Hill to discuss the issue. Ambassador Amina Salum Ali is the African Union's ambassador to the U.S.
African Union decided to have one day, earmark one day in Africa and all over the world to sit down and to reflect on how to help the African children to survive. Because survival is crucial, and African children are struggling for survival. So this day is very important to find a way where we can help African children to have faith, to have care and treatment, so that they can survive, they can reach above 5 years old.
UNICEF reports that in North Africa, Algeria, Egypt, Libya, Tunisia, and Morocco have reduced their child mortality rate by 56% since 1990, partly due to effective anti-measles strategies. In sub-Saharan Africa, UNICEF says Botswana, Namibia, and South Africa have reduced measles death to nearly zero, and Malawi is cited for its overall success in increasing child survival. Hawa Ndilowe is Malawi's ambassador to the U.S.
Package, we have identified 11 priority interventions which we believe will make a difference in terms of delivering quality health care services. Within that, there is a strategy that we have also developed in terms of improving child survival and development. And we call this the integrated management for child illnesses.
With such success, Ambassador Amina Salum Ali says Africa could reach the United Nations Millennium Development Goal of reducing the mortality rate among children under 5.
I am personally encouraged by those successes. They give to all of us the conviction and confidence that if we continue on the same pathway, Africa could be on track to achieve MDG 4.
The UN's Millennium Development Goal 4 aims by 2015 to reduce by 2/3 the mortality rate among children under 5. Lindord Moudou, VOA News. Leah Kebede is a top model, a UNICEF Goodwill Ambassador, and the founder of the Leah Kebede Foundation. A panelist during the briefing on Capitol Hill, she says that keeping children alive starts with keeping their mothers alive.
And me being a mother, I'm from Ethiopia. I grew up, hearing and being in an environment where it was so common for women to die in childbirth, that coming here and realizing that those things don't happen in the developing nation made me think, this has to change also for countries like Ethiopia or any other African country. And we have to really ensure that every woman who delivers with a skilled care attendant with her in a clean environment with basic medicine. She needs a referral system. So we have to strengthen health systems. I think that's probably the best solution. But at the same time, there's also other things like delaying early marriage, making sure that girls have access to reproductive health tools, girls staying in school longer. All these amount to things that can prevent a mother's death during childbirth and pregnancy.
And that was an interesting meeting indeed. And it was
like
very good to see these people coming together and really think about the well-being of these children.
Wonderful. Great report.
Well, for more on health and other stories, go to voanews.com.
And of course, thanks, Lindord, for being here today.
Sure.
And you can watch Lindord here on In Focus every Tuesday and Thursday with the latest health news.